you know, to train them in so as to develop the skills and knowledge in cultural heritage, skills and knowledge in the cultural industry, so that they can either set up their own jobs, if you will, or get employed. You know, it's a project called Youth Path. And I know that PATH has a different, you know, but PATH actually is poverty alleviation through heritage and culture. That's what it is. And through that, we've trained quite a number of young persons in Jamaica who have made use of that opportunity to find jobs or create jobs for themselves. Because after, if you are into carving or into drawing or into, you know, music, etc., you know, sometimes what you need is really a lot of drive, personal drive, and some support from outside.
Jaime Nadal, the UNFPA, what's the focus of your activity here?
We have three main focus of our work as mandated by the International Conference on Population and Development. And those three main areas of work are, on the one hand, sexual and reproductive health. Now, you may wonder, what are we talking about? Well, we're talking about a number of things. One is access to family planning, which is a traditional view about sexual and reproductive health.
We don't have a problem with that in Jamaica.
That's absolutely correct. But there are some other areas that have to do with safe motherhood, for instance, maternal mortality reduction, which is one of the MDGs. UNFPA is actually putting quite an effort into it, together with other UN agencies like UNICEF, like PAHO, World Health Organization, in Jamaica, assisting the government in developing protocols and public education campaigns that can prevent maternal deaths from happening in the country. So that's one area of work. Then the other area of work is HIV and AIDS too. We work very closely with UNAIDS as well as with the other UN agencies in the country in terms of targeting interventions to young people. And in the case of UNFPA, we are the focal point in the UN system for out-of-school youth. And as such, we've been developing a number of projects, particularly with disadvantaged communities too, in terms of working with young men, particularly with young men, in HIV prevention. It's gender and HIV prevention. We're basically trying to confront them with the way they've been socialized and why violence, what it means to be a man, basically, what is positive and what is negative. And, you know, it comes with a number of negative things that have to do with perhaps overly, you know, being overly assertive, aggressivity, violence. It also comes with some very good, you know, connotations, being competitive, etc. So the idea is to get them to realize what is positive, what is negative, and try to get them to work on the negative aspects of it.
Is that an admission that our men need more help than our women?
I wouldn't say that they need more than. I think we are guided by the concept of gender equality. We would like to see a society of equals, you know, where men and women can have both fulfilling lives. Women still have a number of problems, and for instance, women are better educated, but where that is not translated into jobs, and it's not translated into pay when they access the labor market. So they still,
in Jamaica?
In Jamaica, I think, you know, worldwide. I don't think that really and truly any country can claim that they have achieved that. And I think Jamaica is no exception when it comes to that. So we are working towards giving them basically the same opportunities. And we, for instance, among the counterparts that we have in the country, we have the Bureau of Gender Affairs, with whom we work very closely in terms of developing programs in the schools, with parents, etc., trying to promote this vision.
We continue our look at the UN agencies doing work here in Jamaica. Friday, October 24, is being observed right around the world as UN Day. The UN agencies coming out of the Bretton Woods Agreement in the wake of World War II. We have with us Mrs. Miriam Maluwa. She's a country coordinator for UNAIDS in Jamaica. We also have with us the director of the UNESCO organization here, Dr. Kwame Boafo, as well as the deputy representative of the United Nations Population Fund, the UNFPA, Mr. Jaime Nadal. He's related to the tennis player. No, he says. No, he's not. So remember that. Okay, Miriam, the UNAIDS program in Jamaica, what are some of the specific programs you have going on the ground?
Okay, we are, UNAIDS is very much guided by the efforts that we support national priorities So we don't come with predisposed ideas about what programs we're going to run, how we're going to run them. On the converse, we actually work with national partners, largely the government, together additional with civil society and private sector, to identify what would be the priority areas in the area of HIV. So that is a starting point. And in this respect, the United Nations, actually not just UNAIDS, the totality of us, worked with government to support them to develop their national strategic plan on HIV for 2007-2012, which pretty much sets out the priorities that the country would put through in the next 5 years. So that is at the beginning. And then we have 5 main areas of focus. One is political leadership, which is really to mobilize political leadership to engage with HIV as a priority in terms of its own positioning as a government, but also in terms of domestic resourcing, as opposed to international funding. Then the issue of partnership building, strengthening the area of HIV to move beyond the health sector to other public sectors and also to the private sector.
Are the politicians responding well?
Yes, they are. We actually have a situation where now the Ministry of Labour that have taken on the matter of HIV seriously. Today, the Minister of Labour is presenting to Parliament a bill of strengthening their labour laws to better adequately address issues of HIV within the workplace. I mean, we also have the Ministry of Tourism that now has developed a policy on HIV, the Ministry of National Security that has developed an HIV policy. So, yes, the other public sectors have engaged in HIV.
We have heard over these years that the Caribbean is ranking second to sub-Saharan Africa, where HIV/AIDS prevalence is concerned. Is that still so? And what are we really doing well or not?
Is it so? Yes.
It is still so.
And it always has been. It's just that it's never been articulated that way. The Caribbean has always been the second highest region infected with HIV after sub-Saharan Africa. And regrettably, it still remains so. I mean, last year, the figures spoke for themselves. We had about 250,000 people in the Caribbean who were living with HIV.
So where the Millennium Development Goals are concerned, where HIV is related, what's say the scorecard looking like?
Not very good, I must say. The Millennium Development Goal for HIV, countries were really aiming to halt the epidemic by 2015, to halt, not to 50%, but to actually halt it. So, and we were also aiming to significantly reduce the infection rates as we move towards 2015.
With 7 years to go?
With 7 years to go, almost we can comfortably say that's going to be very difficult to meet. And particularly because as at last year, globally, including in Jamaica and the Caribbean, we continued to see quite high numbers of new infections, which is an indication that we're failing to prevent new infections, which is an indication that we're failing to halt the epidemic, which is an indication that we will not have halted it by 2015.
Dr. Boafo of the UNESCO, you spoke earlier about universal access to education. This country has made strides in providing access to education, but there are some deep concerns now about the quality of the outcomes, that quality is not being achieved. When you look at our success rate at the secondary level, at the regional exams, we're one of the worst performers in the Caribbean. Our children are leaving school barely functionally literate. What is UNESCO doing to help the Jamaican government to deal with it?
Actually, we are working with the government in Jamaica, as with the other governments in the CARICOM, to really tackle that problem. Because, as you say, it is not just a question of having universal access to education, which I must say, the Caribbean in general is doing pretty well when you compare it to my part of the world, and I come from Ghana in sub-Saharan Africa.